Hey everyone, today we're here with Dr. Lista and we're going to be doing a Sculptra treatment today. So for those of you who don't know what Sculptra is a type of filler, but not the typical hyaluronic acid filler that you hear about frequently on Instagram and kind of other places. It's something that helps build your own collagen over time. So it's polylactic acid, and the way to think about it is the same way that you think about threads. It's kind of like liquid threads that we're injecting into the face to help you build collagen over time. So today you're going to see us inject Dr. Lista here in the areas where you see some volume depletion. So if we're taking a look at his face right here, we can see kind of along the lateral face. A little bit into the nasolabial folds, maybe build up some of his jawline, maybe into the chin here. We'll be injecting some Sculptra. Now, important things to know about Sculptra. You won't see results right away. The first day you'll probably feel like you've got some volume or a little bit of swelling, and you'll like the way that looks. Over the next couple of days, that'll completely disappear and you'll wonder what you even got done. But after you complete 2 sets of treatments about 8 weeks apart, at the 6-month mark, you'll start to really notice that you've got a lot more volume, the skin looks a lot more youthful, you have firmness that you haven't had before, and that's because it takes this long to build scar formation, or that's the type of collagen that we're building under the skin with Sculptra, to get the benefits that we want.
What we're trying to do is we're trying to inject the polylactic acid and inject it in specific areas, and then forget about it, not do anything. What happens is over 6 to 8 weeks it starts the collagen production, and that's a progressive natural improvement of the face. So he will get an improvement in his facial structure, in the volumization, in the looks, in the skin tightness on his own without us doing any intervention. And it's key to explain this to the patients before we start, because most of the people will look like they're full because of the volume initially, but then after, as the volume goes, they will be like, oh, I didn't see any difference. So granted, there's nothing that's going to show in the first 4 to 6 weeks. Ideally, you start producing collagen after the 6th to 8th week.
Basically, you just want to massage the areas that were injected in a circular with a firm hand. And you want to do that for 5 minutes, 5 times a day for the next 5 days. And the reason for this is you really want the Sculptra to basically mix with the tissue so that we get really good collagen formation without any areas of lumps or bumps. I think that's something that often, if you look at Sculptra up on Google, you'll see that's one of the complaints. And some of the reasons that was happening previously is people weren't diluting the Sculptra down as much so that it could mix very well, and then also just not being mindful of how important massage really is after the treatment. Areas that you can't use Sculptra on, because I know it's a question that will come up frequently, you can't use it in the tear troughs. You don't want to use Sculptra, in the forehead because it's not as forgiving there. If you use it in the temples, you want to be careful, and usually that's done with a cannula, not with the needle technique that we're showing here. So those would be areas that we would not be using Sculptra for.
All right, I feel so much better.